Every year in Ireland, almost 5,000 people die from cardiac arrest. When someone has a cardiac arrest, their heart stops pumping blood. For each minute that passes where CPR is not being performed, the chances of survival reduce by 7 to 10%. When you see someone collapse,
You okay?
check. Is the person unresponsive and not breathing? Shake them by their shoulders and shout.
Can you hear me? Not breathing. Dial 999, get an ambulance straight away.
Call. Get someone to call 999 or 112 or call them yourself. Compress. Place the heel of one hand in the center of the chest between the nipples. Place the other hand on top of the first, interlocking your fingers. Keep your arms straight. Push hard and fast. Each compression will pump blood to the brain and other vital organs. Don't stop until help arrives.
He just fell over, he just collapsed.
Every minute counts. So remember, don't hesitate.
Thanks very much. Great
Check, call, compress. You can save a life.
While we don't expect you to replace first aiders with CPR and defib use, you may be the only one to witness it, and it can help. If you witness somebody collapsed, first check for response. In COVID times, don't place your face near their face. Make your call 999 or 112 to raise the emergency services. Ask for an ambulance, place your phone on speaker, place it on the ground and follow the instructions. Placing a cloth or a towel or a mask over the patient's nose and mouth will reduce the risk of viral transmission to the responder. The responder should also ideally wear a mask to reduce the risk even further. Start with chest compressions, placing one hand center of your chest, second hand on top. Push hard and fast. Chest compressions are the single most important intervention we can do for a collapsed patient. We do so non-stop until the ambulance service arrives or the patient wakes up. AEDs are designed for bystander use. If somebody collapses, get it, use it.
Call for help. Remove pads from package in back of unit. Apply pads to patient's bare chest as shown.
A set of pads should be plugged into your AED. Remove the packet of pads from the rear of the machine. Tear open the pads and attach them to the patient as shown in the diagrams. Once both pads are attached to the patient, the machine will automatically analyse the heart rhythm. There's only two outcomes from analysing: shock advised or no shock advised.
Shock advised. Charging. Stand clear. No shock advised. Shock 1 delivered. It is safe to touch the patient. Begin CPR now.
After 2 minutes, Lifeline will ask you to stop and move back so it can check once again for a heartbeat. If the unit has not resolved the cardiac arrest, Lifeline will deliver another shock and ask you to do more chest compressions. Keep repeating this cycle until medical help arrives.
A heart attack is caused by a blockage or reduced flow in the blood supply of one of the coronary arteries. In turn, the heart muscle suffers less blood supply and causes many of the symptoms associated with heart attacks. Symptoms of a heart attack include, but are not limited to, pressure in the chest, pain in the chest, pain in the left arm, feeling unwell, tiredness and weakness. Our key steps to assisting somebody exhibiting with signs of a heart attack is to rest the body, sit them down and make a phone call to the emergency services or the first aid team. A stroke is an interruption to the blood supply of the brain, commonly caused by a blockage or bleed to one of the blood vessels of the brain. This in turn causes a reduced blood supply to brain tissue and these cells will die.
Good afternoon, sir. Are you okay?
Oh no, not good.
Can I help?
My arm's gone all numb.
Just talk to me for a second. Let me just assess you. Can you remove your mask, please?
Yeah,
I can't see your face. Okay, can you smile for me? Okay, thank you. Let me help you put your mask back on. Yes.
It's all... Oh, this arm, it's all numb.
Is this arm numb? Can you try and raise it for me? Try and raise the arm. Okay, this arm is fine. Can you put this arm back? Try and raise this arm.
No.
A bit more. Okay, no.
It's all dead. It's like, feels like dead arm.
Okay, can you repeat this phrase? Red lorry, yellow lorry?
Red lorry, yellow lorry?
Red lorry, yellow lorry. Say
Red
that
lorry,
again.
yellow lorry.
Perfect. Can I just make a quick call? Sorry. I'll be with you in a second.
There are many reasons for somebody to become unwell at work. Underlying medical conditions or sudden onset of a new condition. Too many to be covered in this course. Talking to the person is the best way to get an understanding of what may be wrong. If you're unsure, seek assistance from your first aid team or the emergency services. If the patient's symptoms lead you to suspect COVID-19 or other respiratory issues, please refer to your COVID-19 policy and isolate the patient and follow the steps required. If you're unable to wake the patient, they are seriously unwell. Get assistance from the emergency services via 999 112 and the first aid teams that are available. Placing a non-conscious patient in a recovery position is a big help to assist in their airway and their breathing.
If you find someone unconscious, check can you wake them.
Hello sir, hello, wake up.
Check are they breathing. If they are, you need to place them in the recovery position. Move their hand closest to you up by their head. Lift their leg furthest from you up by the knee. Take their other hand up to their cheek. Roll them using their knee as a lever. Ensure their airway is open.
This brings you to the end of Module 2. Please complete the multiple choice questionnaire.